You can have two women with the same number of T-score, right? But in the same way, you can have two walls with the same number of bricks, but different wall strength. It's the same thing. Two women can have the same T-score, but one woman can have stronger bone than the other woman because of the material of their bone. Hi, thank you for joining me this week. This month, we are talking all about bone health, and happy Women's Month to you. Last week, I discussed what the DEXA scan is and also described groups of people who are at risk for developing bone loss earlier on. So this week, I am going to be talking about the two main bone diseases that affect women in menopause and perimenopause. By the way, my name is Dr. Odoy. I am the founder of Oasis Women's Functional Medicine. We are a boutique practice located here in Rochester, New York. So what is osteopenia? What is osteoporosis? I'm sure you've heard about T-scores, or you've had someone do a DEXA scan and you've seen the report and it says a T-score and you have no idea what it means. If that is you, stay tuned. I am going to be describing all of that. So your T-score is your bone density compared to a 30-year-old healthy woman. Again, your T-score is seen as your bone density compared to a healthy 30-year-old woman. So 0 is the middle number, or that's where we start. So I want you to visualize a number line where you have 0 in the middle and you have the positive numbers and then the negative numbers. And so if you've seen a DEXA scan, it's reported in negative numbers, right? Because we start at 0, and 0 being the bone density of a healthy 30-year-old woman. And so when we discuss osteopenia, which is considered weakening of your bone, and it's sometimes dismissed and not seen as something serious or something that you should be paying attention to, but really it is at a point where your bone is at risk for fracture, and you don't want to now move into osteoporosis, which is porous bone, right? And so osteopenia is when your T-score is between -1.4 and -2.5. And anything greater than 2.5 is considered osteoporosis. That T-score is just a picture of your bone density. It does not talk about the strength of your bone. So let me let that sink in. So density is very different from bone strength. So I like to think about it as bricks, right? And so you can have two walls which have the same number of bricks, meaning that you can have two women with the same number of T-score, right? That's the density. But in the same way, you can have two walls with the same number of bricks, but different wall strength. It's the same thing. Two women can have the same T-score, but one woman can have stronger bone than the other woman because of the material of their bone. What is their bone made of? And that's where things like collagen comes into play, where we have the proteins that link the collagen within the bone and how exactly your bone is formed. And this is very, very important and very, very distinctive. And so if you get to, if you go and you do a DEXA scan and, it's reported that you have osteopenia, I just want you to be encouraged to know that it is just one aspect of the picture. It is just the bone density. But we also talk about bone strength, and the way we can improve our bone strength is really through nutrition, our protein intake, and I'm going to do subsequent videos next week to break down protein, the vitamin D, the calcium, all the elements that make up a bone. It is beyond, it's not just about calcium. It is a lot more things that come together to make a bone. And so to recap, we talked about the T-score, and a negative 1.5 to negative 2.5 is considered osteopenia, and a negative 2.5 or higher is osteoporosis. Both of these things are risk factors for fracture, and your risk factor for fracture is really depending on your bone density and also your bone strength. And so how do we optimize your bone strength? We optimize it by hormone optimization, your protein intake, nutrients, which I mentioned earlier, and also gut health and reduction of inflammation. And so next week, I am going to be delving into the nutritional aspect and also exercise and how we can build strong bones. So stay tuned. Please forward this video or this channel to any woman you know who is scared about bone loss or is experiencing bone loss and wants to be more educated about the process. I'm so happy to answer any questions you have in the comments. Also note that this is just for educational purposes. I am not your doctor, and so if you have any questions for your particular case, please feel free to reach out to your doctor, or you can ask me also in the comment section, and I'll be able to point you in the right direction. Thank you, and I'll see you next week.